ask you some questions about like your counseling experience and what it's like with patients and clients with you. So,
Sure.
so how long have you been a counselor for, and where have you been a counselor?
So I've been at Punahou for the past this is actually my sixth year. And I've been counseling the whole time. I just finished my master's in last May, so that took about 2.5 years. But I've been counseling throughout the whole time
Okay.
that I've been working here.
Oh, cool. All right. And so, is client-centered therapy your only approach?
I think that's the one that's the easiest with the kids. We use lots of different approaches, talk therapy, and lots. But I find that it's the one that works the best with having students come in, whether it's scheduled or unscheduled, and for them to just feel like, okay, they're just going to listen. They're not going to try to dig more into my life. They're going to let me say what I need to say. When kids start coming in more and more, you build rapport with them, and it's a little bit easier.
Yeah.
But to start off, talk there, or client-centered, that just gets them to feel comfortable.
Okay.
Empathizing with them, acknowledging how they're feeling.
Okay, that's good. So how do you think your approach to helping like students and clients like differs to other counselors?
For me personally, it's knowing them outside of like the office. Whether it's in class or I just came from practice. So like a lot of my girls, they like come in or whatnot, and it's more not feeling like I'm actually counseling them. It's more like having a conversation.
Oh, yeah.
That's the type of approach I like to take, and that's what I tell the kids too. Like you're not counseling to figure it out. You're just really talking to your friend or talking to someone to kind of help them and support them. So for me, it's more like, okay, what is our relationship outside of the office or outside of a counseling relationship, and what is it in the office when you're struggling or when you need some support or help or whatnot.
Okay. Okay. Do you typically see a client or a patient or a student for?
With like the more difficult cases, I usually pass it on to Dr. Hina, and I'm like, you go there.
Okay.
But it's usually, there's no real set time or day that we're gonna reschedule to meet. If it is, it's more like, okay, you look at your schedule, you tell me what works for you, rather than, okay, next week at 12 o'clock,
Okay.
Because I don't want them to feel like this is mandatory for them. I want them to feel comfortable in saying like, okay, this is something I want to work on, or this is something I want to talk about, rather than forcing them to come in. Because I found that when you force someone, not force, when you strongly encourage, it doesn't work out as well, or it takes a little bit longer. So if you give them a little bit of space and then say, okay, let's check in again, that seems to work. So
so have you ever had any difficulty like approaching or kind of helping out a student?
Always. I think it's, and that's the fun thing about counseling. Sometimes you don't actually know what to do or even what they're going to say, and you kind of just go on the fly with it, and you're like, okay, let's see if this works. If it doesn't work, okay, let's try something else. The hardest ones that I've found is kids that are currently experiencing something that I've never experienced. So trying to be empathetic with them, or like trying to find out different methods to help them, or just kind of tips or whatnot. That's the hardest thing, because I'm like, okay, I don't actually even know what you're going through. I can imagine what you feel like or what's going through your brain, but I don't actually know. So if this seems like an extremely outlandish idea, tell me, because we'll work together. And that's what I tell the kids. Like, I'm not here to tell you what to do or how to solve things. I'm here to work with you. If it doesn't work, we'll problem solve again. If it works, great, you keep doing it. But I'm here to help. I'm not here to tell you exactly what to do.
And so has there ever been like a time when with a student or a patient where you don't agree with like the school policy kind of conflicts with your personal belief to how you should help them or how you help them deal with it?
So I've never felt restricted by the school. The only like restriction I feel is if I don't know what to do, and that's when I like get up, walk around the corner, and talk to Dr. Hina.
Oh yeah.
So that's the best part I think about Punahou and with us, that we always communicate. If we have a problem, we don't know how to help a kid, like, okay, who's dealt with this before? So kind of making sure that we keep ourselves refresh by talking to others and getting their input or their feedback.
Okay.
But I've never felt like I couldn't do anything. I've always been very comfortable, and if I don't know what to do, I'll just ask someone else or just encourage the student to maybe talk to Dr. Ahina or talk to the deans or whatnot.
Okay, well, that's good. Okay, well, that's good. I just wanted a little insight on what it's like to be a counselor and how you help students and stuff, so that sounds good. Okay, well, thanks for everything.
You're welcome, Dana. Have fun with the rest of the class.
Thanks. Okay, bye.
You're welcome. Bye.